minimum package, the minimum increase that we need as a, as county governments on.
Next item.
Discuss so that as we go to and you see, the national government should be able to understand. It's clear, for conversion to PLP, 8 billion must be availed in for our normal annual increase. This is the minimum that we need to have, so that even when we discuss that there is a decrease in the figure of our annual increase, then it is understood that that is, we can, if we, for example, say we need an increase of 15 billion or 20 billion or 23 billion for the normal increase, and then we have 8 billion that is non-negotiable. This is the figure that we need. So I think we must really communicate. Otherwise, I agree with you guys, we will be found flat.
Next year will be a very interesting year. That is all I can assure you. It will be a very, very interesting year. Yeah. No. These are normal things, huh? I think first of all, the 47 of us never got here by luck. The population of Kenya is about, 40 million plus? 50 million. Out of 50 million people, 47 of you were chosen because you're amongst the best politicians. So hakuna mtu atawashinda akili hapo. Don't worry.
Yeah. So thank you, Excellencies. The other one is on CHPs. On the CHPs, currently we have 107,831 CHPs reaching 2.7 million households, and all counties have opened special purpose account for the matching fund, which is the 50-50. 50 from national government, 50 from the county government, and the IPS have been signed. So the stipend payment is undertaken by both levels of government. So the current challenges, Your Excellencies, and I know this has also come many a times to the summit, is the issue of conditional grant, which still has not been honored, and the national government is still paying the CHPs through the M-Pesa mechanism. So the county governments, not all CHPs are also kitted, because initially national government just looked at 100,000 that were there, but when we took our stock as a council and county government, we found out that there are 107. So even as the national government is kitting these CHPs, they are kitting only 100,000, leaving a gap of 7,831. And then not all counties are paying CHP consistently. There are counties that are still not paying the CHPs. And if they pay like today, this month they pay, then they jump for another 3 months and like that. So the issue around this is like when national government now will start paying the 50% and it will be going to the counties as a conditional grant for the counties that are not paying them. So what will happen? Then the sustainability of the CHP kits in terms of replenishment. Since these kits have been issued to the CHPs, then it has never been replenished. So it is something that we also need to discuss and see probably how we can be able to replenish or what mechanism can be put in place. So the recommendation is basically for the MOH to honor the summit resolution and transfer the 50% matching fund to counties as a conditional grant for the financial year 25-26. and then under CGAP, and then MOH also to fast-track processing of kitting all CHPs. This issue of CHP has been discussed very many a times in summit. I don't know, because now it has not been honored again. Are we going to take it back to the summit? Because I believe summit is the apex, the top apex that needs to be honored in terms of implementation. But I know for the council, what needs to be implemented has been done, but for the national government, still we have a challenge.
All right, I need to just put a disclaimer there. In the current SIGA, which is has just been passed, the issue of community health promoters is actually there. The figures are there, and that's why I was saying that we are going to propose that we allow the, it's actually here, column C. Nairobi is getting 224 million, Nakuru 99 million, so it's there in the current SIGA. Yeah, but what I'm saying, you know, our argument is that it, based on summit, that it should actually be there. You know, the way we word ourselves and the way so that we don't end up getting tongue twisted. If we are saying that this needs to be put in the county government additional allocation, which is what Katra was presenting, they will say it's already there in the county government additional allocation. Yes. There's two issues which we also need to be able to agree might come up at summit. The first issue that is there is these guys will raise an issue and start saying that some of you guys are not paying CHPs, which is the truth. I had a conversation with the PS. The county government of Mombasa was the last county to agree to sign. I saw this and I told them that this is wrong. You cannot have one person having two paymasters. And I actually made arrangements and I refused to sign. I was the last person to sign out of all 47 of us. Eventually when I signed, we started realizing that there were issues. My proposal is we need to adopt a system similar to the Danida kind of funding. In that way, there is nowhere where it is said that a county will not be paying. So if you don't pay, you're actually not going to. So if you put in money in that account, and it's the right thing, it's truly the right thing. I think there are 13 counties that have not, how many counties have never paid? Never. No, how many have never paid at all? I think 4 counties have never paid even a shilling.
Remember, you have that data? Yes, national government are paying directly through M-Pesa,
yes,
but then the other 50% from the county government is not coming through.
And the agreement that we had was that we pay and national government pays. Yeah. Now, you'll end up being cornered and they'll start naming and shaming and saying that this county has paid, 4 counties have never paid, 13 counties pay whenever people are in a good mood. And by the way, can I tell you why? Not that people don't feel that CHPs are important, but CHPs are the most politically charged up individual in the whole country. These are the people who go all the way to the houses. So probably someone somewhere has seen that this lot of people are against me.
You know, you've gotten almost everything right. It is only that you put them in different shelves. The first question you should be asking ourselves, you know, sometimes we behave very naively. What do you think was the interest of the national government offering to pay CHPs? Yes, it was nothing to do with service delivery. And therefore, when you continue demanding that they put money in your special purpose account for you to pay them, whoever pays the piper calls the tune. P, that some counties are not paying that as an excuse, you know, to name and shame them, and at the same time say, we cannot be able to entrust you with the resources if some of you are not paying. And even if you say it's a matching fund, national government is not willing to leave out some counties because there are political interests in those counties. I live in the backyard of the deputy president of this country. I have seen delegation of CHPs from the whole of Central Province visiting there, being called, either accompanied by the governor or CEC, and addressed different times.